Hello, Tom Levecki here with the weekly edition of the Dr. Steinbrech Live on the Male Plastic Surgery Channel. Dr. Steinbrech, how you doing today?
Doing great. Good, fun, long day. Lots of great surgery today. It was really awesome.
We got to ask what surgeries did you
What
have?
we did? We did a couple of sets of uh, uh, calf implants.
Oh,
One was
perfect.
reconstructive, and the other was purely aesthetic. Nice, big, bold, medial gastroc. Amazing. And these guys didn't have small legs. One guy had just like huge thighs, but his calves just a little lacking genetically. The other guy, unfortunately, was in an accident when he was younger, and had some neuro damage to his calves. So we did a nice correction procedure for him, and then we did some nice chest work on a third guy. So 3 cases, all beautiful, fun cases, and I really feel grateful because I talked to a lot of people, and it's like things have slowed down a little bit since COVID, but the guys know that this is a time to get things done. So nice busy day.
Beautiful. So we'll jump right in. We got some questions. What are calf implants? How do they differ from other type of implants?
Yeah, calf implants. It's really funny that we did so many today, when it turns out this is what we're going to talk about tonight. But we're just doing more and more and more of them. What they are is they're silicone. They're a soft silicone, but a soft solid silicone, which means they're not like a gooey implant that's surrounded by a shell. When you think of a breast implant, they're more like a gummy bear. They can actually, imagine if you have a big gummy bear and you can cut into it to custom carve that implant to the exact anatomy that you want. And this is great because it's funny. I got another question from a consult that we had 2 days ago. They called back, spoke with our patient coordinator, and asked if we have equal ones or symmetrical ones on both sides, or if each one can be anatomically shaped so it's asymmetric in a desired way for that particular patient's anatomy, which I can do with our implants.
Oh, wow. Yeah, because breast augmentation also for women generally is asymmetrical, so sometimes you have to overcompensate, correct?
Yeah, exactly.
The same principle. Love it. Okay. So why have it done? You hit a genetic wall we talk about. Maybe I skipped too much leg day. Why are guys getting it done?
Yeah, it's really not. I know that that's a fallacy. People are like, oh, let's cheat and do calf implants because we're just too lazy to do leg day. That's not what I see. What I see is just as I described today. I'll see a guy that has amazing quads, but genetically he's just a little bit behind with the calves. Or we'll see it for if people have either neuro injury or torn calf muscle, or they may have a really nice calf, but they have a really, really short muscle belly. So it's really high. It's well developed, but it's really high, and they don't have the full length of the calf. So when you look at the calf anatomically, the medial gastroc is a longer muscle belly, and the lateral gastroc on the side is a little bit shorter, but they're still pretty long. And some of these patients may come in with a really short muscle belly for both.
Love it. All right. So, rule of thumb when you hear implants, hey, 10 years, whatever that is, what's your rule of thumb or what do you
Yeah, no, we don't say that anymore, man. If it's great, if it's good for you, these are not your grandfather's implants. These are much more stable. They're a much better quality. They're really a 6th generation implant. And just like the breast implants, I just had this discussion with someone who was watching today that asked, actually, when do you choose? Is it 10,000 miles? When did you change the oil? When did you change the tires? When did you change the radiator? We don't even do it for breast implants for women, but for men we don't either. If you are absolutely happy with the size and the shape of the implant, it's going to be in there longer than you are. And it's very stable. So it's not the kind of thing where we switch it out every 10 years, every 15 years. It's not necessary. It just causes more unnecessary problems with the surgery, unless you want to sort of Pamela Anderson things up to a larger size, or you want to go down and taper your size. Then we may do some changes there.
Got it. Somebody said I got a text that there may be a problem with the chat. I was able to put something through for this particular person. You can text me your question because you have the access. And then, just in case if you're on the replay or you're not able to chat, drop your questions below. We do monitor the comment section, and we always try to answer your questions. We get them to Dr. Steinbrech right away.
Yeah.
Obviously, risk and complications associated with calf implant surgery.
Okay, hold on. What'd you say?
So, the what are the risks and complications
Got
of
it.
calf implant surgery?
Okay, with implants, really, not really much of a problem with infection. That is a risk.
Yeah,
Infection. All these are less than 5%. Infection. Um, uh, uh, the transient nerve issues, either sensory or motor, can happen. Not very common at all. Other things are fluid collection, very rare for that. Hematoma, which is blood collection around it. All these are temporary.
yeah,
Um, uh, and the other thing is if you would have a very intense contact sport that could move the implant around, and we would just move it back. But
got
that doesn't happen either a lot because we secure the implant in good position.
got it. Question: do the implants get irritated from working out? Does it change the structure and look of the implant?
Absolutely not. The implant is stable. The implant just sits right in there for calf implants. It's on top of the muscle underneath the fascia. So you have skin, subcutaneous fat underneath the skin. The fascia, that's sort of like the silk stocking of the muscle, so that the
Yeah,
muscles can glide against each other. That's white silk stocking.
yeah,
And then underneath the fascia, that's where we put the implant. And I'll tell you why. Some people think, oh, don't you put the implant underneath the muscle like we do with the bicep implant to make it pop? No, actually, the space is so tight underneath underneath the gastroc, and under is actually the muscle underneath that is the soleus. It's so tight, it's so small that you can't really have the potential space to put in a nice sized implant. So we still get good coverage if we put it on top of the muscle, and it's even better for the calf because when you flex your calves, contract your calves, it just causes more projection of the implant forward and gives you even better shape when you're moving. So you really notice when you're moving. So that's the advantage of also putting it on top.
Hey, 111, welcome back. Okay, so what is the recovery time before we get into the before and
Yeah,
after?
well, that's that, when we actually do the case. A lot of people ask, should I bring? This is the number one question. Should I bring crutches? No.
Yeah,
It's a good question. Don't need crutches because we're not changing anything about the muscle. All we are doing is make a little incision behind the knee, going through the subcutaneous fat right to that fascia, and then we're just going to slide it on top of the muscle. So we're not interrupting any muscles, we're not interrupting any nerves, we're not interrupting anything. There's a little bit of swelling, but we put numbing medicine so you'll be able to get home just fine. So there's no need to bring any crutches. But to answer your question, after they have the surgery, they go home. Uh, Again, two sets of patients tonight. So right now, I have two patients at home. They're lying in bed, lying on their back. Actually, one guy I did glute implants too, so he's on his tummy. So he can really do either. But the guy who did glute implants, he's on his tummy. He's elevating his legs with pillows. The guy that I just did the calf augmentation, he's lying on his back, but then he has his calves elevated on top of pillows as well. We put wraps on him. The wraps keep the compression out so they don't swell unopposed. And the wraps also help us keep the implant so that it stays in position well, because we want the implant to be exactly in that 3/4 position. Everybody wants the implant to to be able to see peeking around the corner from the front. You don't want to. That's another thing about when I do implants. I really want to make them truly anatomic. So I'll put in two heads rather than just stuff a big block in the back. There's no definition. All my guys want to see the individual heads of the gastrocnemi, and so that's why um, they get that beautiful anatomic shape. And that each implant goes into 3/4 position. That means it just peeks around to the front, so you can see that sexy contour from the front, or obviously you can see it from the back. But
Yeah.
the rookie mistake is to put one solid one, slip it right underneath the skin. Doesn't look right, looks fake, and also it looks very edgy because there's just not a lot of coverage there. You want to get in the two individual pockets of the two individual muscles.
Another question that's being texted in:
Yeah.
what about the front muscle alongside your shin? Like, could you put an implant in there in the front? You wouldn't put an implant in the
You
front.
know, that's a great question. Usually, what I do for that is it's better, and I did it tonight actually, because one
Yeah,
of the guys had some scar around that front muscle that you're talking about next to the shin, the pretibial muscle. One of the guys had a scar there from his previous injury. So I guess what I did, Tom? What do you think I did? I did some body banking,
love it.
right? So we took the fat away from his flanks. He was on his tummy for the calves anyway. Put in some tumescent fluid. That's the wetting solution for the body
Yeah,
banking. Took out those cells, loaded them up some beautiful syringes, and then injected them to soften up that contour that runs around to the tibia. And it looks fantastic. And it also, this is another little point for the pros, is sometimes guys come in and they have, and also by the way, women have calf implants as well. But what they come in, either men or women, is their ankle may be very narrow, and so to augment the heads of the gastrocnemius and not have it look too, turkey leg, what you want to do is use some body banking, and I can carry that down all the way to the ankle. Some people a lot of people that get very self-conscious about having little stibbly kind of skinny little ankles, and they want thicker calves, but they also want thicker, less anemic looking ankles. So that's where we feather down the body banking as a composite. So a composite is the cake and the icing, the frosting on top. So
got
we
it.
use it as a composite, and it looks just fantastic, and it feathers, and it's nice and even.
Beautiful. Okay, before we wrap up, we're just going to go through a few cases. It can be found on
Yeah.
look below maleplasticsurgery.com. So this is case number 343523. Unfortunately, it's either our face or these beautiful calves. So put the calves up. Obviously, you can see them, Doc. If you can kind of walk us through.
Yeah, so this is the first part of it, which is the medial calf. That's what people always want first, 99% of the time. So the incision is hidden behind the knee, and people really don't mind the incisions. They fade quite nicely. I don't think I've ever had anyone ask or need to cover it up with a tattoo or anything. So it doesn't seem to be really an incision that bothers people. Also, I mean, these days, if it did really bother you, everybody tattoos anything and everything. So that's always a bailout, even though it
Yeah,
doesn't. You don't really see it, but you can see on the right side that he's got a beautiful bump there, a really nice contour. You can see I did on purpose. The patient's right leg is tilted a little bit to the side so you can
yeah,
see more of that projection, in contrast to the left leg that is actually what we call AP, anterior posterior, that is directly at the camera. So you can see when a patient's standing at the beach and they start And what guys really love to do is they kind of stand on one leg, and when they shift their weight to one leg to the other leg, you can see that contour just pops as the leg rolls around, like super sexy, super muscular.
Okay, let's take a look at this case. 12262
Yeah,
seems to have kind of bigger quads, bigger
yeah.
legs to begin with. However, you see the definition. Obviously, your left is before, right is after. Walk us through this case, Doc.
Yeah, this is a really interesting case because he actually had pretty decent mass, but just as you said, not as much definition, did not get that muscular pop. Just with this is the kind of case where we did not need to do any body banking down into the ankles. He actually just had too much, no definition, no change in contour from the calf to the lower leg down to the ankle. So this, and in some cases, I even do liposuction of the calf, of the not the calf, but I do liposuction of the ankle, which creates that definition and creates that contour for patients that have where their ankles are too thick and you don't see any different definition, don't see any sexy contour changes between the gastroc and down to the ankle, which just that's a great thing about going through different cases. Everyone is so different and everyone has different desires and different ideas of what they want to improve the results.
Okay, so we're going to take a look back at a different angle for 12238.
Yeah,
Before we wrap up, just kind of walk us through again. You have a little different
our
angle.
dog wants a cat.
No worries. Again, ambient noise, little different angle.
Yeah.
And like I said, just walk us through, how you do the markings and how you do the insert.
Yeah. So what we do is I always have them face the wall. I have them stand on a little step stool, and we have them stand on their tiptoes. So we see the contraction of the calf. It's absolutely imperative that you get it to match up exactly with your calf. That's why I really don't like when some plastic surgeons just do that single block calf implant. And so we mark individually where that muscle is. And it's so important because I want the patient post-operatively to make sure that that implant just stays right where it's because they get some homework. I did have them go home, and even though I secure the implant for in position, I want to make sure that it stays locked in and heals exactly right where we want it, directly over the muscle. So I mark out the muscle. Usually I'll even mark out the fibers of the muscles. And then I mark two lines on each side so that they know where to put the external bolsters on top of the skin to make sure that that implant doesn't move 1 millimeter and stays in perfect aesthetic location for the ideal result.
Very nice. So
Yeah.
this week was all about calf. Well, today for you, but this week on the show is all about calf implants. Maleplasticsurgery.com. You can see everything about implants, body banking, uh, pretty much any procedure that you are looking into for under the umbrella of male plastic surgery.
Yeah.
So, Doc, I'll give you the pleasure of giving the sign off for the week.
Yeah. And the last point I'm going to make is
Yeah.
it's really interesting. This is one of the interesting phenomena about body banking, about fat grafting. So listen, this is an important point because number one, there's only so much that you can bank anywhere. And I'm from Iowa,
Right.
and I always tell my patients, you can't paint the barn with one can of paint, right? So a lot of times you have to be selective about where you put it. So we try and put the fat where the body loves it and has the highest area of retention, which is shoulders, the traps, and the butt. Pecs a little bit less, but the long bones, biceps, triceps, and the calves maybe even a little bit less. So the best strategy that I tell people is put the fat where it counts and where your body is going to love it. It's going to love it, like planting a seed in the tropical jungle versus planting in the desert. So put all those good cells, all that good clay into your shoulders, into your traps, into your chest, into your butt. And then areas where it doesn't receive the fat as quite as well, that's an ideal location to put it in the calves. But the other issue is some guys come in and they don't have any fat. And the guys who are in WeHo, you know who you are, the guys who are in Chelsea, these rip roaring, we just had IFBB, Mr. Olympia. Those guys are ripped. They don't have any fat cells anywhere. So it's also an ideal place where people want to help sculpt their calves, but don't have any fat to do body banking anyway. We can do it, but if you want to do it in a lot of different places, I always say that women plastic surgeons are interested in 4 bumps, 2 bumps in the back, 2 bumps in the front. But for the guys, they want bumps everywhere, all over the place. So we reserve the implants a lot of times, even when we're doing body banking, to the rest of the body for the calves.
Love it. A little noise crackling, but no worries. You heard it, Doc. Thank you so much. Thank you for checking out the weekly podcast on Mel Plastic Surgery.